You're listening to The Scoop on Ultrasound, where the world of ultrasound imaging comes alive through dynamic conversations. This episode is brought to you by EDM Medical Solutions.
Jeremy Ng returns to share his expertise in medical imaging and non-invasive cardiology. As the cardiology manager at AnMed Health in South Carolina, he brings extensive experience in advancing imaging techniques to enhance patient outcomes. Previously, Jeremy served as the team lead sonographer and technical director at the Christie Clinic, honing his skills in echocardiography. In this episode, he discusses the latest advancements in 3D and structural heart imaging and their impactful role in modern cardiology. Quality supplies make a difference. At EDM, our mission is to help you enhance patient care. For over 30 years, we have been a leading supplier of medical imaging products and accessories. It all started with one product, Crystal Ultrasound Gel. And now our catalog includes over 300 products designed to support your practice. From probe covers to needle guides, EDM Medical Solutions is the partner of choice for over 2,000 healthcare facilities in the U.S. Learn about our range of ultrasound solutions on our website by visiting us.edm-imaging.com.
Welcome back to the Scoop on Ultrasound. In this episode, we're diving into the exciting topic of advancements in 3D and structural heart imaging with Jeremy Ng, who's joining us for his second appearance on the show. Jeremy is the Non-Invasive Cardiology Manager at AnMed Health in South Carolina, where he brings a wealth of expertise in medical imaging. Before his current role, he was the team lead sonographer and technical director at the Christie Clinic. He is a fellow of the American Society of Echocardiography. He also holds a Bachelor of Science in Diagnostic Medical Sonography from Grand Valley State University and an MBA from the University of Illinois Urbana-Champaign. Additionally, Jeremy holds a PMP certification in project management. So you might remember him from season 1. He shared invaluable ergonomic tips for sonographers. So we're thrilled to have him back to discuss the latest in 3D and structural heart imaging technology. Jeremy, thank you for joining us again.
Yeah, I'm very, very happy to be back. It's definitely good to be on the show, and I'm ready to get the ball rolling.
Appreciate it. Well, let's jump right in. Cardiovascular diseases are the leading cause of death globally. The WHO says it accounts for an estimated 17.9 million lives every year. Now, with the rise of things like 3D imaging, we're able to better visualize cardiac structures in really what is unprecedented detail without invasive procedures. So this technology plays a critical role in diagnosing conditions like congenital heart defects, valve disorders. Jeremy, could you give us an overview of how those 3D imaging techniques are being applied in non-invasive cardiology today?
Yeah, so our lab actually have recently adopted 3D echo imaging, and it has seen a lot of success. One of the things that we do is on the TEE side, which is the transesophageal echo. What we do that is mostly in the surgical suite, especially during the transcatheter interventions. We do a lot of things like mitral valve repair, left atrial appendix repair, and atrial septal defect closures. And all of those things require as accurate of a measurement as possible with the device sizing and also procedural monitoring. So 3D echo does play a very, very important role in determining the success of those interventions.
Right. And, how do those methods compare to traditional ones? Could you kind of walk us through very briefly? Because, I'm not going to ask you to do a whole history of the evolution of the technology, but very briefly compared to the things you might have done, say more than 5 years ago. What are some of those big advancements that you've seen?
I think one of the things I can see the most advance in is actually during surgery, where we do 3D imaging actually reduces surgical complications. So with 2D imaging in the past, it is a lot more difficult to determine the exact location especially of like paravalvular leakage. So with 3D imaging now, it's a game changer, I would say, at a surgical suite. We are able to determine the exact location of where the paravalvular leakage are. And then, with that, the surgeon's able to intervene and reduce any surgical complications. So that's one of the ways where 3D have a very significant advantage over 2D imaging. Another thing that we used to do, especially for transthoracic echo, is the ability to measure LV volumes and LVEF. So with ejection fraction being the most important thing that the physicians see, having 3D, doing volume, 3D volume and being able to calculate it more accurately in that aspect, does help with our clinical decisions. So those are the things that I see with the evolution from 2D to 3D. But there is still an evolving field, and there are still many things that could be done to advance in this field. And adoption hasn't been as quick in the non-invasive side versus the more like interventional side. Definitely you could see a huge uptick where at a cath lab. And P lab, but not more by a transthoracic echo side.
Right. And I mean, that leads me into my next question, the next point, which is that there was a 2018 article published in the Structural Heart Journal that showed that the integration of 3D imaging into structural heart disease care has significantly enhanced procedural efficacy and safety. So sort of the interventional aspect of what you're talking about. They were saying how hybrid imaging during those cardiovascular interventions really was able to enable peri-procedural visualization by integrating the different modalities. And according to the authors, that's a way of improving, those outcomes. So with such advancements in 3D imaging, obviously there being many more to come, it's still clear that the technology is going to transform the way that we approach structural heart disease care. So could you just share a little more now on your perspective on how the developments have improved patient outcomes, the ways that you think it could improve patient outcomes, and perhaps provide examples where 3D imaging has made a meaningful impact on treatment plans in your practice or in the practice of those around you?
Like I mentioned earlier, one of the major things that 3D imaging has impacted patient outcome is the determination of any surgical complications. So, for example, when the physician is able to detect the leakage, the exact location of the leakage, they are able to go in and intervene before the patient is off the table. So what that means is you'll reduce the amount of surgical complications post procedure. Another thing that 3D imaging really does help is obviously measuring the EF more accurately and the LV volume more accurately. This will give the physician a more better way of doing their treatment plans, and also reduces the amount of medication errors. So it does help in those aspects. They're able to also quantify the aortic regurgitation after a TAVR procedure. And it seems to be far more superior and more accurate in 3D compared to 2D. And that is something that a lot of physicians or cardiologists are struggling with, is to quantify how severe the regurgitation is, and whether what kind of device you need to employ to successfully treat the patient. So having a more accurate quantification of the aortic regurgitation also does help with 3D imaging.
If you are high-level disinfecting your ultrasound transducer, it's likely you're soaking the probe or using an automated HLD device. But there's a better option out there. TriStyle Old can high-level disinfect your transducer in just 2 minutes and costs under $3 per cycle. Sound too good to be true? Request a brochure today and learn why so many practices are switching over to TriStyle Old. Visit us.edm-imaging.com/TriStyle. That's TRISTEL. And now, back to the show.
Now, when it comes to patient communication, how do you think that technology such as this one could really help us enhance that aspect? It being a fact that, communicating conditions to a patient can be difficult. Do you think that these technologies are playing a role, can play a role? What's your perspective on that aspect?
Yeah. I think that definitely advancement and technology can definitely help with communication with patients. That is something that cannot be done without the education of our physicians, as well as the nurses that is assisting with communicating all of those procedures and the post-procedural instructions, as well as the results and all of that entails with technology like 3D imaging, putting in additional verbiage, like on their report and just, describing it in more layman terms. Those definitely will help with communication. But ultimately, I think communication does fall on the physicians and also fall on the hospital. And that's something that, as a whole, I would say that technology can play a role in automating some of the steps and also refine some of the way we communicate with patients. But when it comes to echo and just technology improvement in echo, there might be just some indirect improvement for communication regarding the accuracy of the reports. But when it needs to be from a higher level when it comes to communication.
Right. That makes sense. So moving on to the 3D imaging market as a whole, it's incredible that the global market for 3D medical imaging was valued at $41 billion in 2024. And it's anticipated to grow at a rate of 18.5% in the next 5 years alone. That's according to Grandview Research. So the demand for the tools is there. It's needless to say. Among these advancements, we have the AI playing a role in that, right? So now we have more AI powered imaging tools that are not only enhancing diagnostic accuracy, but they're also trying to allow for real-time surgical planning, which you've kind of touched on already. There's innovations like holographic imaging in the works. So with such rapid growth and groundbreaking innovations in the 3D imaging world, I'm curious, what do you see as the most promising advancements in 3D imaging and structural heart imaging today? And how do you think these developments could shape the future of cardiology? Because sometimes there's a lot of advancements being thrown out there. Not all of them have been validated yet. Honestly, not all of them will probably see the light of day or will be effective. So which ones do you think, no, these I think are really going to play a big role?
I think definitely one of the things that's going to have the most significant effect is the temporal resolution for 3D imaging. That is something that has been in development for a while. And one of the main struggle with 3D imaging is that it just takes quite some time for it to construct, and or even when during a light 3D imaging, there's a lot of lag and delay, and the temporal resolution there just isn't up to speed. In a surgical suite, temporal resolution is really, really important. So having those improvement in 3D imaging for temporal resolution is really, really what I see has the biggest impact. And as well as for AI, there's an article recently that featured a company called Cardiac Field that is trying to challenge 3D reconstruction using AI. So instead of using a 3D probe, they are just using a regular probe, but they just use AI and deep learning to generate a 3D image instead of just relying on the probe. And it has showed a lot of promises, but there are still some challenges that needs to be addressed.
That's incredible, though, to hear of such things in development. I mean, it goes to show that it's the tip of the iceberg, right? There's a lot more that is coming. Now, while there's a lot of potential, I'm sure you're ready to talk to me about the barriers that are there. because there's always barriers to adoption. We already know that the cost of adopting advanced imaging systems for a hospital could mean upwards of 3 million, depending on what they're looking for. And that's not including training and maintenance. So this is not this is an expensive field, so to speak. And of course, when you're adopting new technologies, it could be expensive too. Now, in addition to the financial barrier and those considerations, right? What challenges do you think healthcare systems, hospitals face in adopting advanced imaging technologies, such as the ones we've been talking about? Because I know you alluded to the fact that we're not totally there yet with the adoption.
I think one of the key areas, honestly, communication. Having a strong leadership for the department and advocating to upper management about why it's important for us to adopt that technology. Using ways like how adopting those technology not only can impact patient safety in a positive way, but also impact revenue and also have implications in cost savings. So if leadership is able to accurately quantify and effectively communicate that with the executives, then they will more readily be able to support me and be able to help adapt those technology faster. Because I think the main issue that a lot of hospital face is that there is nothing to show. Like, we can adopt those technology, but what do they achieve? So, able to communicate all of those, the pros and the cons, and what it can bring to the hospital, what it can bring to patient. If we can communicate that very definitively to the executives, then they'll get the buy-in and they'll support the advancement and support us adopting those new technology.
Right. So you would say lobbying is very important, right? When you're advocating lobbying or no, but that makes sense. I mean, I think that sometimes it's hard for all the different stakeholders, especially in a big system, to exactly understand, is this worth it? And I think to a certain extent that's a valid question. And so the clinical outcomes or the potential what it could be has to be proven, and that takes a lot of effective communication coming from the imaging leader in that sort of facility. And that leads me into my next question. You yourself, of course, are in leadership. So, as a healthcare leader, how do you approach introducing new imaging technologies? So, how do you go about doing this, especially for those who are in similar roles to you, who are clinical leaders, and they're like, man, I'm just not really sure how to go about introducing AI, all these different things. What are your tips and what's your approach?
So introducing new technology, that's something that not only we need the executives buy-in, but we also need the technologists to have a buy-in in it as well. The reason why technology aren't implemented is actually a lot of sonographers just don't see the value in those. So just selling them to our staff and telling them the reason why we need to adopt those things is key to success, because the foundation of the technology being implemented is actually from the staff buy-in. One example I have is recently we implemented strain imaging in our lab. We have many presentations and many seminars about strain imaging, and we tell them the value of it and what it does to the lab, and we also sell it to the cardiologists. And with all of those buy-in, right now we are able to implement it, and we do strain imaging on almost every eligible patients. And it has bring tremendous value to clinically, as well as the ability for them to track the patients more accurately. So I think the main thing we definitely need to do is communicate with our techs and have them believe in the technology that we are trying to bring into the lab.
Right. That makes so much sense. I think sometimes that could even be a point that's overlooked, right? We're always looking up and we think we have to only convince executives, but it's true that the people on the ground, right, which are the actual sonographers, the ultrasound users, also need to be on board, right? Can't just be one person pushing it forward. And it's so important to remain forward thinking as a clinician, Obviously with a certain degree of caution. I know it's good to be cautious and to make sure everything is tested, right? But there's a great benefit to that. So I think that you're right in the fact that there's a need to always be inspiring and pushing people to look to the future and to adapt. So now with 3D imaging rapidly evolving, I already talked about how in the next 5 years, that market is expected to grow a fair amount. The demand for skilled professionals is higher than ever. I know that sometimes, or it's something that we've all heard, there's a fear that AI is going to replace professions. That, of course, is also a fear I've heard from sonographers, ultrasound users. Is the AI going to replace me? I don't think that's true. I think the consensus points to that not being true because the U.S. Bureau of Labor Statistics actually predicts a 14% growth in demand for diagnostic medical sonographers by 2031. And as we know, with many different healthcare roles, there is a shortage of sonographers. We definitely need more. So this really makes it an exciting and rewarding path, especially with how you've been saying technology is evolving. From your perspective, as someone who's experienced and now you most likely mentor other sonographers and you lead them, what advice would you give to aspiring sonographers or healthcare professionals even who are maybe interested in making a switch into sonography? What would be your key pieces of
So I think my key advice is to really do a good shadow at a really good lab. Before is very different doing your research online and seeing what they're doing, but compared to actually going into the lab and being in the trenches and seeing what they actually experience and what they do, because sonography is much more than scanning a patient, taking beautiful pictures. It's more about having a connection with the patient, asking the right questions, making sure you get the right image and answering the question. And also a lot of the physical aspect where you need to take care of yourself ergonomically. You need to make sure that you are very detailed oriented. You need to make sure that there's a lot of things that is involved in this profession. And yeah, it's very exciting. It's a constantly evolving field. But also, I do caution people to actually do a lot of research before delving right in, because there is a lot of work that needs to be done. The board exams is very, very, very difficult. So definitely
right?
before you make that time and that money investment, definitely do a lot of research. Talk to an actual echo tech or vascular tech, and just make sure that this is the actual field that you're passionate about.
No, that's really good advice because sonography is very challenging. It's very complex. I think sometimes, those who are outside of healthcare, maybe considering a career in it, might not even know that much about it. And I might think it's simple, and it's really not. It's not simple. It's very complicated, but very rewarding. And we've had many guests such as yourself share that with our audience. And I know that our audience agrees. So thank you so much again, Jeremy, just for coming on again, sharing your insights. I think that the best is yet to come for echocardiography, for cardiology. There's just such incredible advancements, and it's always great to hear from a leader such as yourself who is really trying to be at the forefront of the developments.
Yeah, it's my pleasure. It's always a good my pleasure to come here and share my knowledge and to talk about sonography.
Thank you for listening to this episode of The Scoop on Ultrasound. Subscribe today to be notified when new episodes are released, and visit our website, us.edm-imaging.com, to learn more about who we are and what we do.